This topic is on rheumatoid arthritis. So the illustration here, I have the difference between a normal joint and a joint affected with rheumatoid arthritis. So rheumatoid arthritis is a chronic, progressive, systemic, inflammatory autoimmune disease that affects primarily the synovial joints. Systemic means that the disease affects the body system, affecting many joints and other tissues. In rheumatoid arthritis, there are these things called rheumatoid factors, and these rheumatoid factors will form and attack healthy tissue, causing inflammation. So the disease will progress to involve the articular cartilage, joint capsules, and surrounding ligaments and tendons. And fluid will also accumulate in the joint space and form a pannus. And the pannus is a vascular granulation tissue composed of inflammatory cells, which deteriorates articular cartilage and eventually destroys bone. And as a result, abnormal fusion of bones and joints and calcification will occur. Since rheumatoid arthritis is a systemic disease, other parts of the body, including organs, can be affected. So if blood vessel involvement occurs, the organ supplied by that vessel can be affected, and this can lead to eventual failure of the organ or system in late disease. For your assessment, the onset of rheumatoid arthritis may be acute and severe or slow and progressive. So patients may have vague symptoms that last for several months before the diagnosis, and the stage can be determined by early signs and symptoms or late signs and symptoms. So for early signs and symptoms, with the joint, you'll see inflammation, and systemically, you will see a low-grade fever, fatigue, weakness, anorexia, and paresthesia, also known as numbness and tingling. For late signs and symptoms, this will include joint deformities with moderate to severe pain and morning stiffness. Systemic signs and symptoms to watch for are osteoporosis, fatigue, anemia, weight loss, subcutaneous nodules, peripheral neuropathy, kidney disease, and Felty's syndrome. Laboratory tests can help support a diagnosis of rheumatoid arthritis, but no single test or group can actually confirm it. Some labs to look for are a positive rheumatoid factor. An increase is indicative of possible rheumatoid arthritis. Decreased levels of albumin will occur with chronic inflammation and infection. Patients with rheumatoid arthritis may also have an elevated ESR and ANA. Other diagnostic procedures include arthrocentesis, which may be used for patients with joint swelling caused by excess synovial fluid. Standard X-ray may be performed to visualize the joint changes and deformities typical of rheumatoid arthritis, and a CT scan may help determine the presence and degree of cervical spine involvement. And for nursing diagnoses, the priority nursing diagnoses for patients with rheumatoid arthritis include pain related to chronic inflammation, decreased mobility related to joint deformity, muscle atrophy, and fatigue, and potential for decreased self-esteem image due to joint deformity. So when planning care, the goal of management is that the disease goes into remission and its progression slows to decrease pain, prevent joint destruction, and increase mobility. So some planning to do, the patient will maintain an acceptable pain level using the pain scale of 0 to 10 during my shift. Another one, the patient will verbalize feeling of increased strength and ability to move at the end of their hospital stay. And third, the patient will identify strengths and healthy coping skills during my shift. All right, so for implementation, with rheumatoid arthritis, a healthcare team manages pain by using a combination of pharmacological and pharmacological measures. So one implementation that may be used is a synovectomy, and this will be implemented to remove inflamed synovial tissue from joints, which will provide relief for the patient. A total joint arthroplasty may be indicated when other measures fail to relieve pain, so that's kind of like a final stage procedure. Drug therapy will be used and this includes NSAIDs, which will help promote comfort and decrease inflammation. Most commonly used are disease-modifying anti-rheumatic drugs, or DMARDs. These are given to slow the progression of disease, and for the best results should be started early in the disease process. Few examples of DMARDs include methotrexate, leflunomide, and hydroxychloroquine. One of the newer classes of DMARDs are biological response modifiers. Most biological response modifiers put the patient at high risk for developing impaired immunity and infection, so it's important to teach the patient about that. Glucocorticoids may also be given for their fast-acting anti-inflammatory and immunosuppressive effects. Non-pharmacological interventions that may be used include adequate rest, proper positioning, ice and heat applications. Heated paraffin or wax dips may also help decrease comfort of the arthritic hands. Finger and hand exercises are often done more easily after paraffin treatment. Adequate nutrition is also important for the management of rheumatoid arthritis, and other alternative therapies include mind-body therapies such as relaxation techniques, imagery, and spiritual practices. Physical therapy can also be implemented to strengthen muscles and prevent further atrophy. Patient safety is of utmost importance with rheumatoid arthritis. Patients' mobility can be impaired, which puts them at high fall risk. When caring for these patients, you want to assist with ambulation and teach them to balance activity with rest. Fatigue can cause decreased mobility along with muscle atrophy. So energy conservation is very important with these patients. For the evaluation, when evaluating the care for the patient, the expected outcomes are that he or she achieves pain control that is appropriate to the patient on a scale of 0 to 10. The patient will move and function in his or her own environment independently, with or without assistive devices, and he or she will verbalize increased self-esteem and positive perception of self. Thank you.